Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. This podcast is for informational purposes only and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. We will discuss opioid use, opioid treatment, and physical and psychological trauma, which may be triggering for some listeners. Listener discretion is advised. On the final episode of our first season, we're speaking with Dr. Glenn Sterner, a professor and researcher whose current projects include the examination of opiate abuse networks, illegal opiate distribution, and community police networks to address the opioid epidemic. In this episode, Glenn and I discuss the creation and evolution of the Someone You Know campaign and reflect on our efforts to combat stigma and inspire hope in our communities. I'm your host, Heather Major, and this is Someone You Know. So, Glenn, you're our final guest on our Someone You Know podcast, and we're going to be talking to you about your focus as a researcher and also the work that you're doing, more qualitatively in the community. And I think it'd be great, though, for our listeners to first hear a little bit more about who you are.
Well, first of all, thanks for having me. I think this is a different way to reach people than we have even imagined before this, right? And so my name is Glenn Sterner. I'm an assistant professor of criminal justice at Penn State Abington. But more importantly, I'm a resident of the city of Philadelphia. And so it's our job to make sure that we're doing the best that we can, elevating stories in this project or in other ways, but really just doing the best that we can to address this issue.
Let's first talk about more of your work in the criminal justice space as a researcher and as a professor, and then maybe we can talk a little bit more about share your opioid story, its origins, and then share with our listeners sort of how the Someone You Know campaign evolved, because it was really a collective effort, and you are a huge part of it. So take us through what criminology or criminal justice means, just for anyone who might not be familiar.
Yeah, well, so I think it's really important for people to know that when you hear criminal justice, when you hear criminology, when you hear those types of statistics, that there are people like me who are out there working with agencies like, for example, the Pennsylvania State Police, the DEA, or the Drug Enforcement Agency, the FBI. There are real people out there trying to make sure that we're making sense of what's going on in our communities and finding ways to make sure that we're making them as safe as possible. So I actually am not a traditional criminologist. I came at this because I was doing some research in my PhD program at Penn State. During that time, I was in my PhD for rural sociology. I was interested in what was going on in rural spaces. I come from a small town in Michigan, and during that time, this was 5-6 years ago, and this was right when we were starting to see this emergence of a heroin crisis in these really small places, right? So I could never imagine thinking of heroin in these small little towns, and I couldn't help but think, how do we address this? How do we make sure that we're making an impact? And so I took on this role of exploring and examining issues of drugs within our communities on a broader scale basis in Pennsylvania.
So Glenn, we've had the good fortune of being able to work together, but one of the things that through our conversations that came about was your interest and pursuit of share your opioid story. Can you tell us a little bit more about that?
Yeah, absolutely. So, as I mentioned before, I started down this rabbit hole of addressing issues of drugs in our communities, right? Most of that was around working with law enforcement and looking at the supply side of things. So how is it that we can work with law enforcement, find ways to reduce the supply of drugs getting into our communities? How do we do that? I was giving a presentation out in Hershey, Pennsylvania, of all places. Small group of people. So this woman comes up to me after I gave my presentation, and she says that I have a son who has a substance use disorder, who has an opioid use disorder very specifically, and he is incarcerated because of some issues associated with that. And she said to me, I can't really talk to anybody about this. I can't talk to my family. I can't talk to my friends because they're going to think I'm a bad mom. They're going to think that my son is a bad person because he has an opioid use disorder. And I don't know who to turn to. And I couldn't help but think in the back of my mind that there has to be something we can do about this. People shouldn't have to fear talking about this issue, whether it's with their family, people that you should be able to talk about anything with, right? Or your friends and family members who you should be able to rely on as a support system. And then we had the good fortune of meeting at the Penn State Center of Philadelphia. And so I got to learn a little bit more about what Independence Blue Cross was doing, specifically the foundation around the STOP campaign. And we thought, we should get together.
For us as the foundation, it's really important that we're hearing and elevating the voice of the community. And so your insight was instrumental in bringing this to our attention and bringing light to this issue and just how difficult the stigma of addiction can be. Your role, well, most people may not know, the Someone You Know campaign videos. Your role in that is instrumental to this campaign. Do you want to tell people a little bit about sort of what you do? And you're in the background, but you're a big part of why those videos are as compelling as they are.
This is exactly what you probably have learned along the way too, and been able to reflect on and think about how it is that you can help to elevate the voices of others. One of the things that I fundamentally believe in is the ability to use my experience in the places that I exist within to elevate the voices of others. And in this campaign, you all made that happen, right? The Independence Blue Cross Foundation made sure that we share these stories and voices with the world.
There's two parts to this I don't think people realize. There is the Someone You Know campaign, which is a very external-facing campaign. Obviously, this podcast is part of that campaign. Billboards, digital advertising. There's really not a whole lot we haven't done. Exceptional stories, a traveling exhibit. There's a lot to the campaign, but this campaign really is just an extension of your work through Share Your Opioid Story. You want to tell our listeners a little bit about that, because that's a tremendous platform that you've taken to a whole new level.
Well, so part of this is that we wanted to make sure that we had the ability to reach any audience, right? So we recognize that Independence Blue Cross, their focus is the Philadelphia region, as it should be, right? Like that's the communities that you serve on a daily basis. We wanted to be able to make sure that we could connect with other external entities. For example, we've been really fortunate to be able to also include the Pennsylvania Department of Drug and Alcohol Programs as a partner in all this work. But the Share Your Opioid Story project, initiative is what I typically call it. It's a platform for people to share their stories. Share their stories of how they've been affected by the opioid crisis. We have stories that we have captured and cultivated together. We have stories that people have been submitting through the website themselves. We also have stories that were submitted to the Department of Drug and Alcohol Programs. And the reason that we wanted this platform to simply exist and to be able to be a resource for, frankly, any entity that wants to use it, you can navigate to shareyouropioidstory.com. I fundamentally believe that when you engage with this content, you will be a changed person. You can't walk away after seeing Michael's video or reading about Joelle. You can't engage with that content and not have a different perspective than when you started. And so the more that we can do and spread these stories far and wide, the better. The reason that I think stories are so profound is that a story stays with you. A statistic doesn't. I think in the very beginning we initially talked about it's really great to do this research, but numbers are important for measurement. They are important for resources. They are not necessarily important for, as much as we like to think, attitudinal change, behavior change, stigma reduction. And that's why the focus on stories has been so profound for me. We know that stories change behaviors and they change stigma.
While you were just speaking, I was reminded about something that made me really believe even more deeply in this work, and that this is a tremendous opportunity for a conversation starter. Specifically, I'm reminded of when one of our colleagues had shared this campaign with her cousin, who is a nurse, and she teaches at Penn, and she shared it with her students, and actually used it as curriculum, and is now being embedded in curriculum for Penn Nursing, which I thought was really great because it tested the students' bias, and I thought that was really neat. And that's one of those things you don't expect, sort of the added value.
Yeah, I think that this is an incredible resource. You don't want to say the wrong thing, right? You don't want to offend people. And most of the time, frankly, that's what I've seen, is that people don't know how to start that conversation. They don't know where to go, and they don't want to say something that is going to make it worse, right? Or make somebody feel bad. This is a way for you to go and hear about real people's experiences. Familiarize yourself with the actual experience of a substance use disorder and what people actually go through in that journey. Hear about people's grief process, how they were able to work through that, what you might be able to say to a loved one who has just lost a friend or perhaps a family member, right?
How about you? What about your perspective on stigma? Has it changed?
Absolutely. Like I said, you can't go through these videos. You can't have been involved with this project and not be changed, because I think that it's so profoundly different from where we started. When you start a project, you have an idea. You hope that it turns out in a way that you will make people proud who participate, and you hope you reach the outcomes that you're setting out for. Not only do I think that we met those outcomes and met that I think that we have exceptionally succeeded and exceeded that. And even for all those of us who've been involved with it, are different and change people because of it. I'll admit, at the very beginning of all this, I still didn't really understand the concept of disease and addiction and substance use disorder and how those three words, concepts all kind of fit together. I do now. I fully understand and recognize that these are people who are facing a disease and they need to be supported. They need to be treated with compassion. We need to make sure that they have every single opportunity to succeed that they possibly can have. What about you?
I see stigma in a broader sense now. I think that this campaign has gifted to me is not only new connections, new friendships, a new appreciation for other people's journeys and experiences, which I try to value as much as I value my own. But I think it's also helped me understand the complexity of the disease of addiction, and also the need for to really not look at it as a one-size-fits-all in terms of treatment and recovery, and that people need to be able to find their own paths, but options need to be available to people to have their own paths. So I think that's one thing that I've learned from the willingness of others to talk about their experiences, the joys and the sufferings. To never judge a book by a cover has just been reinforced time and time again through this campaign. And I've met some of the nicest people, truly the nicest, most caring and compassionate individuals. Like I said before, that I would never have been able to, I probably would have never crossed paths with. I've cried, I've laughed, I've hugged a lot of people, I've received a lot of hugs in the process. And I think at the end of the day, the most profound effect on me has just been the idea that I might not have met any of these people had they not been able to get the help that they needed, and that they wouldn't be here with us today. So if anything else, it's just sort of that realization of, if not for them speaking out when they needed to, and for someone reaching out and lifting them up and helping them, they might not be here today. And I can't imagine the world without them. And I hope that they know that. So I've learned a lot, but it's also just enhanced my world tremendously. And it's great to have these great people who are off and doing great things in the world. And now we're all connected, and our stories are all connected. And I think that's a wonderful thing.
I agree. And one thing that you talked about was making sure that we, frankly, recognize the courageous nature of these people who've been so willing to share their stories with us, right? It's not easy to sit down with a stranger with a camera crew or a tape recorder or what have you in front of you and talk about some of the deepest, most hurtful, most traumatic experiences that you probably may ever go through as a human being.
Your darkest moments. And the feelings of shame, vulnerability. I couldn't agree with you more. And then to, on the advertising side of a campaign, to be willing to see your face on a billboard, and not just you see it, but the hundreds of thousands of commuters that drive, 76 or I-95 or take SEPTA, our public transit system, or to open up the Inquirer and to see to see a full page or half a page advertisement with your story. To do that, to truly break the anonymity that is so protected in the addiction community, it's tremendous. And you remember in the beginning of the campaign, we had nothing to show people. It was blind faith that people said, sure, because I know how this can help. I want to help someone else. So it was never about them either. It was always about them helping someone else. Universally, I heard from every single one of our ambassadors that if it helps one other person, then they've achieved the goal.
Absolutely. And whether that's a story or, I think about all the work that they're doing in the actual community themselves. Like people who are actively working every day to making sure that they are having a positive impact on others every single day.
Every day.
And so it's the courage to be able to speak out and talk about your story, courage to be able to do the work that you're doing through the Someone You Know campaign, but it's also the courage to take that one step even further and be so incredibly active. I don't think I've ever met a group of people, and I'm obviously a little bit biased now because I've gotten to know them so well, and I'm just so enamored with them at this point.
I'm so impressed.
Exactly.
They're the most impressive group of people I've ever met.
It's been really incredible. I'm not a person of lived experience. I don't have experience personally with a substance use disorder or substance use disorders in my family. And so it's one of those things where I don't necessarily fully will never understand your experience, right? I will never be able to walk in your shoes fully. But I'm really happy to be there to support you. And I'm really happy to understand because as a gay person, I understand discrimination, right? And so discrimination is always on my mind. And so making sure that we can help others who may be facing very open discrimination right now, I think is incredibly important. And every single one of our ambassadors are doing that. You're doing that. Every single one of the staff members here is doing that. We're doing this in a collective manner to make sure that discrimination doesn't win.
How do we reach people that might have a different opinion on the matter? I'm sure you saw the recent study released by Pew. They did a poll of Philadelphians, and two things I took away from their study. Three really. One, I'm glad they did it. Two, stigma is still a very deep-rooted issue in our community. But the third, and maybe the most profound and sort of the positive that I always like to, I like to put that first, is that there was still a great deal of empathy, regardless of your view of addiction and whether it's a moral failing or, a disease. I know that when this campaign is heard by people who think like us, who view stigma in the same way that we do or similarly to how we do, that's really easy. That's more of an echo chamber, and it's good for that message to be out there and to be heard. But one of the things I'm going to talk more about today briefly is just your thoughts on how do we reach people and reach into other communities that maybe don't see stigma of addiction the same way that we do, or stigma in general in the same way we do. What are your thoughts?
Yeah, and this is something that I've been thinking a lot about lately, because it's that next step, right? It really is. I talk to a lot of people like ourselves who have very similar views. That echo chamber is really real. I get into this bubble and I think, oh, everybody feels the same way. We're winning, right? And then you see some of those results, like the Pew results. I, as an academic, study social networks. I think one of the areas that I am passionately interested in is how we can harness those social networks, hopefully, to do good. And so I think, first of all, it starts with each individual. Individuals have that power to change another person's perspective, whether it's immediate or not. We don't have to change it all in one day, but if you reinforce those behaviors, if you reinforce by your actions that you do not believe that this is a moral failing, that this isn't a disease, and that you are somebody who cares, that will listen, we have the power to impact people. And I don't think that we recognize that power enough, whether that's in our families, whether that's in a random community gathering that you might not necessarily think that you have an impact, you have an impact. So I think that that's where we start. Second of all, I think that we have to keep continuing to elevating these stories of what we've already been doing, finding ways to make sure that it reaches the eyes of those who, frankly, need it. We have to make sure that we do this public health campaign, whether it's the Someone You Know campaign or whether it's other campaigns that we can help to support. We need to all work together to make sure that we are getting these stories in front of the people that need to see it. All the time, every day, whenever they possibly can. It might not happen right away. It might not happen that second time, but hopefully that third time they'll click on that. And then the third thing is that we still need to make sure that we are providing those platforms.
Like you said, and no matter what contextual setting you're in, you can talk about this at work. You can talk about this in random encounters and in a social way. You can talk about this in church, the grocery store. That this is not limited to these sort of events and subject matter specific types of engagement. This should be a conversation that we're willing to have anywhere. So, Glenn, it's been 3 years since we started this project. Which is very hard for me to believe that it's been that long, because I feel like with any labor of love, you feel it in a way, but also you reflect on it and you think that went by very quickly. You mentioned measurement as a next step of your work. What about some and share your opioid story? Visions for the future. What do you see as next?
The first thing that I'm really excited about is that there are other places that are interested in the work that we're doing. Right now, I'm connecting with folks over in the state of Missouri. The state of Missouri, for those who don't know, is one of the few states who actually saw an increase in their overdose, and quite a large increase, unfortunately. There are overdose deaths associated with all drugs, but specifically opioids in the past year. Whereas many of us are seeing reductions. Thankfully, Pennsylvania had that. That was really great. I'm glad to see that. But there are these other states who maybe need a little bit more help. And so the state of Missouri and Mizzou, University of Missouri and Missouri Extension are really taking this head on. There's a whole group of folks in the St. Louis area that are interested in this work. They have a storytelling festival every year. So they're already keened in and very interested in the stuff that we've already done. I'm excited to start that partnership. And if we can start doing this in other states, that's my goal. My grand vision would be that every single community, every single location all across our country has and knows about these resources, that they can rely on those resources and can utilize them to engage in their community however they best see fit. Because we know that when a community takes on that experience and takes on and owns that initiative, it's going to be much more successful than if I came in there from Pennsylvania and went all the way to Washington State in a small town and said, this is what you need to be thinking about. I can't do that. They can do that. But we can provide them the opportunity and the resources that they need. So that's one of them. The second is evidence-based practice. So it's really great that we have these stories, but as a scientist, I want to make sure that what we're doing is making the right difference, right? And moving that needle in the right direction. I fundamentally believe we are, but I need to be able to prove that to other people that say that we are. And so that's what I'm going to be doing in the next several years. This is not a one-year experience. So the more that we can measure these things, the more that we can measure the outcomes of the work that either you're doing or I'm doing, or frankly, what any other stigma reduction initiative is doing out there, we're happy to come and measure that. And we're happy to take and then utilize that knowledge to hopefully spread those best practices to other places. Because when you have something and you hold on to it, that's really great. But the best way to make sure that something stays alive is to pass it on. And so the more that we can pass expertise on and learn from other people in different areas, I think that we're going to be more prepared to be able to take on not just stigma associated with substance use disorder, but frankly, I think stigma on a broader scale.
And it inspires me to, to keep pursuing this type of work, and certainly, stigma on a broader scale, because I think not only do the stories inspire people and inspire hope and recovery, but the campaign itself has sparked a movement, and I think that's really special. But I think the work that you're doing to pursue that on a national level is really, really important. But also respecting the fact that it's local. So nationally, yes, we want to see this. We want to see people speak up in every community, and to have those resources and to have that support and to be able to address stigma. Because we know on the other side there's recovery, and there's so much joy in a life of recovery. But also to just recognize that it's a local effort. So it's going to take communities. It's going to take real people with real experiences, real perspectives, real journeys to want to carry this forward. And hopefully that's one of the things that our listeners have taken away through all of these stories is if you're in any way thinking about how can I be effective, how can I be involved, the answer, I think we would agree, Glenn, is fairly simple. Be willing to have the conversations. Be willing to have them and start them in settings and situations that you might not think would fit, but certainly work, and to share the resources that are out there. And I think that's a responsibility we can all take on individually. So I thank you for that. Anything else you want to add before we wrap our last episode of our first season?
Well, I just want to say that it's been just really fantastic. I didn't frankly realize it had been 3 years. I believe in the work that we do collectively. I believe that we are stronger when we're working towards the same goals. And so it's just been a really incredible journey to be on with you, and I'm really glad that you said yes. And thank you to all of our ambassadors, every single person who's shared their story and will continue to share their story, right? It's really making a difference. You are making a difference in the lives of people all across Philadelphia, across the Philadelphia region, Pennsylvania, the world. People are listening to this podcast in different countries. I'm always happy to support you.
And I have to give you your due credit, Glenn, because without the work that you do and without the acknowledgement and the recognition of an individual struggle, a couple years ago, the thought of engaging legislators in our nation's capital, our state's capital, wasn't even a thought that we had. A traveling exhibit wasn't a thought that we had. A podcast was not a thought that we had. But the receptivity of all of that gives me great hope. On behalf of the Independence Blue Cross Foundation and everyone who has taken part in the Somebody Know podcast, I'd like to thank our listeners for tuning in and being part of our efforts to break down the stigma associated with opioid and substance use disorders. We hope you are inspired to continue the conversations in your communities and will stay engaged with someone you know using #SYKOpioids. Most importantly, we hope you understand that this crisis impacts us all: neighbors, coworkers, classmates, veterans, advocates, and nurses. Whether you are looking to access treatment, maintain long-term recovery, support a loved one, or you're grieving the loss of a loved one to an overdose, please remember that you are not alone. Recovery is possible. We hope you're inspired to join the movement. Again, I thank you for listening, and until next time.